Well, federal and provincial health ministers from across Canada are converging on Vancouver tomorrow to talk about improving health care in this country, from lowering the cost of medication to caring for our aging population. Now, no doubt there will be many competing interests, but advocates for people with rare disorders say it's their turn and are demanding that their concerns appear on the agenda. Belle Puri explains.
At first, all was well. Then there were signs something was wrong. At 5 years old, Nicholas Harkins was diagnosed with a rare genetic disease that left him without an enzyme critical to development. Now he's 19 and speaks about being the first in Canada all those years ago to be treated for the disease called MPS.
I hope that all Canadians with rare disorders can have the same treatment and care as I had.
The Canadian Organization for Rare Disorders says that's not the case, and Canada urgently needs a national strategy to help people avoid extraordinary and unnecessary barriers to diagnosis and treatment.
The biggest obstacle is that we do have 13 different jurisdictions that are doing healthcare, and quite frankly, there hasn't been an overarching national approach.
1 in 12 Canadians has a rare disease. That's almost 3 million people. 2/3 of them are children. Over the past 50 years, disability and death due to illnesses like cancer, heart disease, and diabetes have been cut in half. But when it comes to rare disorders, Canada is far behind on a national strategy compared to other countries. Patients and their advocates say it's time to recognize that access to rare disease treatments needs to be part of mainstream health care.
Where wouldn't a national strategy help me? From diagnosis to access to meeting people, access to treatment, medications. I don't know where to start and where to stop. There isn't a single part of my medical background which wouldn't be affected by such a strategy.
A lot of people I know in my group of diseases, it took them a long time to get diagnosis, and unfortunately it isn't a black and white disease where the symptoms are A means B. So it takes a long time to get diagnosed and a lot of frustration going through that process.
In a message to Canadian health ministers set to meet in Vancouver, the call is for timely, quality care, regardless of the disease. Belle Puri, CBC News, Vancouver.